Okay, thank you, Steve. Steve's recording. Go, Steve. You can leave the room now, thank you. Okay, right, James. So you finished your assessments. I've got questions now. The scenario you've just done, what is your working diagnosis and your rationale behind it?
So the patient initially had a TBI, and he was complaining about some pain in his abdomen, which seemed to be on the right side here. So there's liver, gallbladder, potentially some damage there, which might have caused some internal bleeding. As the job went on, the patient became further unconscious, and so the brain injury was potentially had a bleed there and was getting worse. So yeah, he also had possibly a fractured ankle. Yeah.
Okay, so your working diagnosis was a TBI, right?
TBI, yeah.
Okay. Next question. How do you determine the difference between a minor TBI and a severe TBI?
I believe that once he has a GCS below 10, it will become a traumatic brain injury.
Okay. Is there any part, if you're talking about your GCS, is there any part of it that...
Yeah, the motor score, once it goes below 5, I believe, will become a traumatic brain injury, a severe one.
Okay. What are the possible causes of the patient's shock?
When I was palping his stomach, there was quite a lot of pain there, so I figured that could have caused him to be shocked. There could be some internal bleeding, but also the traumatic brain injury. That could have also been possibly the primary cause of the patient's shock.
Okay. Describe the rationale behind your treatment, and specifically, what are you trying to prevent, and can you explain how your treatment reduces that risk?
Okay, so with a traumatic brain injury, the primary insult is when the patient experiences the injury, and so from there we try to stop the secondary injuries within the brain, and so we're actually trying to keep the patient's blood pressure at 120 systolic by fluid loading, because we want to avoid hypotension. We also gave the patient some oxygen, and because we want to avoid hypoxia, and the other things we try to avoid are hypo and hyperventilation.
Okay, yep.
Right.
Now, if that patient had had a seizure, what would you have done?
If the patient had had a seizure, then we could draw up some midazolam and administer that IV 5 milligrams.
Okay. So, I guess you've just almost answered that. So if you had to administer drugs to stop the seizure, what would you give? So the drug, the dose and the route.
Okay, so yeah, in our procedures it says to use midazolam, and we give 5 milligrams IV,
Yeah.
and we can do that up to 2 times. And then if that doesn't work, then we can, well, it's not in a, I think we can also give sodium valproate, which I believe is possibly an ICP skill.
So coming back to the midaz, you can give 5 mg IV. Can you give a IM dose?
Yeah, you can give up to 2 routes.
Okay, how much IM?
I think according to our procedures, I believe it's 10 milligrams IM.
Okay, thank you. That's all questions.
Okay.
Okay, I'll go and stop recording.